Recording in progress.
Good morning, honorable members. On this Tuesday morning, no, it's Tuesday, it's Wednesday now. Wednesday. Good morning to our staff in Parliament and to those who have joined us to be part of this portfolio committee. We meet to deliberate on the processes of our Tobacco Control and Electronic Systems Delivery Bill. May I request that while we are making the preliminaries, after our just short meditation, the presentation is flighted so that it doesn't take long for persons to still ask for a connection. Those who are the first presenters, if they could then liaise with our team and get to be part of being sharing rights. But let's just start by observing a moment of silence in our meeting today. Okay, thank you, honorable members. We'll then continue. We take that this meeting is taking place within the precinct of Parliament, and therefore all rules that apply to a parliamentary process for committees will also apply to this meeting. We request that honorable members please remember to just unmute when it is time to reflect or speak, otherwise it gets to be disturbing the meeting. If for any reason I'm not able to recognize your hand, or you are not able to use the gadget there to raise your hand, please just shout. We'll then record you as having been recognized for a meeting. Let me then give this opportunity to Ms. Machalamba to indicate who are the honorable members present in today's meeting.
Good morning and thank you, Chair. Present is Dr. Dhlomo, Ms. Kego, Ms. Shabangu, Ms. Zine, Ms. Kumalo, Ms. Clark, Dr. Leroux, Mr. Mjadu, Ms. Mailola, Mr. Van Staden. I've received an apology from Dr. Liklape. Thank you,
Chair. Just a small correction. Is Honorable Miss Mailola? Huh? Miss. Okay. Thank you very much for that. I hope the team is actually loading their presentations now, Ms. Machalamba, so that we just start, rather than to say, please give me sharing rights. They must then indicate to you, they'll give it to them. Honorable members, we are meeting today. We have two presentations, one after the other. We will have to understand that to the team, we are going to be very strict on time, because some of us will have to move into, I don't know where to park. When I go to Cape Town Parliament, I know where to park, but now going to ICC, you have to look for parking, told move out, get there, good, and the meeting starts at 2. So we'll be able to keep to time here when we start. To the advertising regulatory board submissions on the tobacco bill, we want to indicate to you that we have received your slides. It's over 40 slides, but your time will be limited to 30 minutes. And we have read your slides and we are familiar with them. So it's a matter of you highlighting them. Thereafter, the members of this portfolio committee will interact with your presentation, and will then ask you to come back after you have taken a pen and paper. And all of us asking one by one, you have to write down what we are asking. Then you come back again to clarify those clarity-seeking questions and comments that would have been raised by honorable members. So we will then say your 30 minutes starts now, and therefore at 10:05, you would have completed this presentation, and you then have to adjust your time of your more than 40 slides. Thank you very much. Introduce your team and then you start.
Thank you very much. Thank you very much for this opportunity. And I had no idea it was so many slides. Do not worry. I'm not going to speak for 40 slides worth of speaking. I will go through it quickly. My team is just me. I'm Gail Schimmel. I'm the CEO of the Advertising Regulatory Board. And as I said, thank you so much for this opportunity to make a presentation on our submissions on the tobacco bill. Can everybody see my screen? We're good with that.
Yes,
Okay.
we can. Thank you.
Great. Okay. I just want to start with talking a little bit about what the Advertising Regulatory Board is, in case not everyone is familiar with us. We're a self-regulatory body. We have industry members, which I will take you through very quickly. We are recognized by the Electronic Communications Act, which binds our decisions on broadcasters. So radio and television have to listen to our decisions. We make decisions about the content of advertising, and we have a code of practice that is around the content of advertising. We're a non-profit organization. We are reactive. We have to receive complaints before we can do anything. We don't pre-clear advertising, and we don't have the resources to monitor advertising. So we have to receive complaints before we can act. And we follow the international gold standard. We follow the ICC code, and we also, this self-regulatory model is how it's done all over the world. It's not just in South Africa that we do it like this. Decisions are binding on our members through our membership contract, on the broadcasters through the Electronic Communications Act, and the Constitutional Court has confirmed that we can make decisions on advertising of non-members for the guidance of our members, so that we can tell the broadcasters, the out-of-home media, the newspapers, etc., which ads we have made decisions about, what we have decided, so that they can then make a decision about whether or not they should carry the advertising that we have ruled against. Our members, just to take you quickly through it, the way that it works is different. Industry organizations are members, and these industry organizations that you're now seeing on your screen, in turn bind their members to our jurisdiction. So you can see that between those members on the screen, we cover a wide variety of the industry. What's important for today's discussion is the Vapor Products Association is a member of the ARB, and their members are bound by our code, and I will be talking about you through this more. We worked with the Vapor Products Association, and I want to just pause and give you, even though I've promised to be so quick, a little bit of insight about how this came about. I am a mother of teenagers, and I discovered the hard way that there was no legislation against marketing nicotine products to minors. I discovered that there was the Tobacco Act, and you can't market cigarettes and tobacco to minors, but there was nothing stopping the vapor products businesses from marketing to minors. And I approached, in my capacity as CEO of the Advertising Regulatory Board, I approached the Vapor Products Association, who were very happy to come on as a member and very happy to commit to a code of advertising regulation. This is an industry that wants to do the right thing. This is an industry, I didn't have to fight them. They wanted to be there. They wanted to come on, and we worked together, and we came up with the Vapor Products Appendix. And I'm not going to take you through it in detail. I think this is where I've got so many slides. But I think the first part, the part that I'm passionate about, was not marketing to minors, not associating vape products with social prominence, distinction, and success and sexiness and things like that. And you'll see, those of you who are familiar with the alcohol rules, that this very much echoes the alcohol rules. This is very similar to the alcohol code. Another very important thing is that they can't use phrases like safer than when they compare it to tobacco. They have to be able to substantiate their claims. They can only make factual claims. They cannot make health claims unless they are actually registered as a medicine. And they cannot, they have to have warnings like this product contains nicotine and is addictive. They can say that their product is less harmful than tobacco, but they cannot say safer than. So the idea is that they have to be marketing in a way that leaves no doubt that this is still a harmful product, but it is less harmful than tobacco. And then there's some very strict rules about under 18. Not marketing to under 18s. If you have a social platform, you have to make it clear that only under 18s are allowed on that social platform. I want to be very clear. We strongly support the ban on the advertising of traditional tobacco products. We think that that is something that has been correctly done and must continue to be done like that. We also strongly support protecting consumers against all dangerous and addictive substances, and nicotine is very much up there. I am, in my personal capacity, a very anti-smoking person and an anti-vaping person. I think we do need to protect people strongly, but the reality is we are not going to stop people smoking completely. We saw that with the lockdown bans. We saw that people get around this, that people don't actually want to look after themselves as well as they should. And the truth of the matter is that vape products, while again, I say as a mother of a teenager, I'm distressed by the existence of vape products, but the fact of the matter is they do seem to offer significant health benefits over traditional tobacco. And I have in my written submission, I have linked you to all the research on this, and I'm sure that you are in possession of more of that research than I'm, in fact, in possession of, as my lights go out here. So we have to work within that reality. We have to accept that there are these health benefits, and that for people who are smoking tobacco, moving to vapor products may, in fact, be a health gain for that population. And for that reason, we cannot parcel vapor products with traditional tobacco products for the purposes of advertising. They need to be treated with a nuance that is justified by their health products. And we would submit that the code that we have in the Advertising Code of Practice, the Vapor Products Appendix in our code, does achieve this, that it is a nuanced approach to a nuanced product. And it has the further advantage that it has complete industry buy-in, and it was created in collaboration with the industry. And I have to tell you, we're not seeing a lot of complaints in terms of this code, which indicates that the main players in this space are sticking to this code and are keeping the rules. We therefore propose the following amendments to this bill. We think that there should be a separation of traditional tobacco products from vapor products for the purposes of Section 3, the advertising. We think that there should be a recognition of the role of self-regulation, and the Advertising Regulatory Board should be the first port of call in complaints about advertising and in regulating advertising. We would love if there was a requirement that any entity carrying out business in this industry be bound by the decisions of the Advertising Regulatory Board, because this would ensure that not only the members of the Vapor Products Association, but also the rogue players, the importers, the dodgy ones, the guys that we need to get control of, would be bound by the code. We think that there should be a listing of the minimum requirements that the department requires from a self-regulatory code in the bill, and we respectfully submit that it should be based on the current code. And that we think that there should be, because we recognize we are a self-regulatory body, and self-regulatory bodies are inherently limited in our powers. So we think that the way that we could work based on a co-regulatory framework, on self-regulation, working with government regulation to achieve in this important area of consumer health, to achieve the best outcome, we should think there should be a mechanism for referral to the department when the advertiser in question fails to comply with the Vapor Products Code. So that the first port of call is the Advertising Regulatory Board, but when our mechanisms of enforcement have failed, that we have a way to upgrade that matter to you, to refer that matter to the department, and then the department can then take it from there and make sure that those rogue players who refuse to listen to the Advertising Regulatory Board will listen to the department. And this is also a way where the department will not become bogged down with the initial complaints. The Advertising Regulatory Board, we can deal with the initial complaints. We can deal with those players who are prepared to play the game, who are prepared to keep the rules, and the department will only be bothered with those players who are not prepared to keep the rules, who are not prepared to comply with the self-regulatory code. And despite all my slides, I'm finished early. So I'm open to questions, and I'm going to stop my screen share and hand back over.
Bouquet of flowers. I won't tell the other people that I've sent you a bouquet of flowers. Not because I like, not because I like your presentation, because you're just saving the committee time. Yeah, let me recognize. I see this time around, Honorable Dr. Leroux is beating up the other team members. His hand is up first. Let me just see how I get to recognize all. Yes. Dr. Leroux, you woke up early today and you said you won't miss. You are the first one to ask a question. So let me start with Honorable Leroux. Dr. Leroux will be followed by Honorable Sine. Dr. Leroux. Second, Sine. Can I see get hands, honorable members, so that we do one round? Sine.
I'm covered by this section. Thank you, Chair.
Honorable Dr. Motubatse, you are covered. I didn't speak badly about people. Honorable Shabangu. Okay. So I have 4 hands, 1, 2, 3, 4 for now. Honorable Dr. Leroux, number 1, followed by Honorable Sine. Honorable,
My hand is up also, Chair. I'm sorry.
Honorable Motubatsi, you are number 3. Honorable Shabangu, you are number 4. Honorable Clark, you are number 5. Honorable Kumalo, you are number 6. In that order, honorable members, please no pause in between. When the other member says, thank you, I'm finished, then you take over because you know your number. Dr. Leroux, number 1. Silne, number 2. Mutubatsi, number 3. Shabangu, number 4. Clark, 5. And Kumalo, number 6. Thank you.
Thank you very much, Chair, and thank you very much for the presentation. And yes, it's also thank you for the initiative that your organisation has shown in terms of trying to bring to prevent advertising to minors, as you've done before this legislation came to the table. I just wanted to get to ask 2 questions around your presentation in terms of your proposals, and maybe just for a bit of clarity. From what I understand is that you, of course, have members, people who are part of who pay fees and who are bound by your rulings, and then you have people who are not bound by your rulings. Now, from what I understand, you're proposing is that you're saying that in terms of this legislation, you would feel that it would be you feel that there should be some scope for marketing some of these products as less harmful in the current than smoking, for example, but you would like it to be controlled by you, and that you'd be the first port of call if there were problems with the way that things are being marketed. And I'm just trying to understand in terms of legislatively. I mean, of course, at the moment you don't have any kind of authority over organizations that are not part of you, but you would like to propose that is the case. Is that so? That's the first question: is that you would actually have your rulings would be binding for everybody within the industry, and not just those who are members of from your side. And then the second issue was maybe just around I mean, so the legislation obviously currently sees all of these products as harmful, and therefore is not allowing for any marketing of these products at all. And I just trying to understand your strongest rationale for why you feel that there should be a distinction between the two, and why you feel that there should still be advertising allowed for those products. Thank you very much.
Thank you very much, Chairperson. And let me welcome the presentation. I only have one question, Chair. I have taken note that these new tobacco and nicotine products are said to assist people in quitting. Kindly share with us scientific evidence from South Africa that supports this assertion. And also share with us how the medicinal products advertising is controlled in South Africa to avoid miscommunication on products, efficacy, and benefits. Thank you, Chair.
Thank you very much, Chair, and thanks for the presentation. I can hear from your presentation you are vehemently opposed to the tobacco products. You are for vaping, and we've been having experience of illicit trading, in particular of the tobacco products. You mentioned that you are a self-regulatory board. Can you share with us, in respect of illicit trading, how would you, or how do you control, or how would you advise that illicit trading be controlled? I'm talking this in respect of vaping, because we can't take for granted that because it's vaping, there won't be illicit trading in vaping. And because it's vaping, there won't be illicit products that are inserted within the vaping product. Because one of the concerns have been that we suspect that some of the products or vaping is being used to transport illicit or illegal products such as drugs, such as marijuana and all those. How would we make sure, or how do you make sure that that is prevented? Thank you very much, Chair.
Thank you, Chair, and good morning to yourself and all the members and the presenters that are in the platform. In the presentation, you agree that no consumer should be encouraged to start vaping. Hence, there are undeniable health benefits to the traditional smoker who swap over to vapor products. Furthermore, you submitted that it is important health of consumers that the industry is able to communicate these important health benefits in a factual and clear manner while not encouraging non-smokers to start vaping. Then how do you stop manufacturers or retailers from encouraging non-smokers to start for gaining customers in the absence of regulation that limits misleading communication about the product? Secondly, why do you advocate for advertising of newer products when currently there is no targeted market segmentation to users only, particularly with respect to sales on internet and social media platforms that are accessed by all and not just smokers? Thank you, Chair.
Thank you, Chairperson. I've just got one question and sort of clarity seeking towards the end. Please explain whether you see a difference in health benefits versus harm reduction. Because vaping is also not good for your health. And there are studies that found that long-term use of electronic cigarettes or vaping products can significantly impair the function of the body's blood vessels, increasing the risk for cardiovascular disease. So when talking about advertising, it should be clear that health benefits would be an entirely inaccurate wording. Thank you.
Thank you very much, Chairperson. Good morning to all honorable members, the presenters that are in the platform, and our officials. Chair, I'm just having one question. The presenter is proposing a self-regulatory advertising code. Can you share with us what is entailed in the code, considering that the latest survey in 2025 reported by experts at the University of Pretoria showed that 1 of every 3 e-cigarette user had never smoked before? Would you still think self-regulation through advertising code is working? In your presentation, you agreed that no consumer should be encouraged to start vaping. There are undeniable health benefits to the traditional smoker who swaps over to vapor products. Thank you, Chair.
Okay. That was the last one from my members. If I can just add on them one. Can you confirm if the Vapor Products Association CEO is a board member of this regulatory board? And if so, is the board not conflicted in defending the restriction of advertising of products promoted by its member, and should have declared this position in the statement? That's very important for us so that we can see the conflicts of interest if they do arise. Now, I would want you to be very strong in really saying and agreeing with me that if you advertise any product, vapes being one of them, and in your packaging, you use very famous, successful personalities. We are not attracting grandmothers there to we are attracting young people. You are. And what is your comment on those vapes that are actually strongly advertising and showing famous personalities, successful people, young musicians who are successful in the world being part of that? Now, I've seen some vapes that actually would then say, I know I drink a particular cool drink, whether Coke or Fanta, when they actually begin to share that to say, if you use these vapes, they're as good as you are drinking Fanta or Coke. What is your view on vapes that are actually having these? I mean, look, even when it comes to tobacco, you tell the adults should really stay on mint or menthol. Some of the people, why do you flavor it with the issues of chocolates, vanilla, strawberry, grapes? Are you not? You are not attracting my grandmother by doing that. You are really attracting young people. What's your view of these mushrooming vape shops all over next to universities? Of course, you are going to say to us, no, but a 21-year-old is an adult. But you already are saying the adult population, because you would then be tempted to say to this committee, let's actually limit the vapes to the financed people, the older ones, big ones. But so to some extent, we just cut down and ban the single vapes, because in any event, they have a two effect. They are targeting the young people, but they are also a huge impact on the environment. And therefore, yes, the bill will be very strong. I'm thanking to you I'm thankful to you when it says it is actually saying this and that about tobacco. So it is strengthening some of those loose gaps in tobacco, the tobacco products. But this is a new thing in the market where we are met with vapes, and therefore we are studying it in a way that this is a new child on the block, and we might err on the side of less regulations or strong regulations and see how it goes as we go along. Please assist us with the responses on this. So thank you very much.
Okay, thank you very much for those questions. A lot of very stimulating questions there. And I'm going to start by just, as a general overview, being very clear that our expertise is the content of advertising, and all our comments is about advertising issues, not necessarily about the surrounding issues. But when I get to specific questions where that is relevant, I will point that out. So the first question was whether we're asking for non-members to be bound. The current situation is, as I said, the Constitutional Court has confirmed that we are allowed to make decisions about the the advertising of non-members for the guidance of our members. Yes, we are asking in an ideal world that the legislation could recognize the Advertising Regulatory Board to the point that it binds any actor in this space to the jurisdiction of the Advertising Regulatory Board. The previous organization, the Advertising Standards Authority, did have this in a number of regulations, so there is precedent for it being done where the regulation kind of creates a co-regulatory framework where self-regulation is working together with governmental regulation to achieve that. And that for us would be first prize in this, because there are always going to be rogue players who are not prepared to listen to the self-regulator unless they're made to. The second question is, why do we feel there should be a distinction? And I think that really goes to that this is not like the other sin products, for example, tobacco, for example, alcohol, where every situation is the same for every user, although even there, I suppose it's nuanced, because for an addict, it's different from a non-addict. But we do feel that there is that distinction, that there is a market here, the smoking market, where this product is, while still bad, better. And I think that is an important distinction. It sounds funny as a self-regulator who pull people's advertising and make rules about advertising, but we do feel very strongly freedom of speech is one of the core constitutional values, and one has to be very slow to limit freedom of speech. And we think that with a product like this, where it is not 100% bad, where there is a market where it can be of benefit to know about the positive, and I use the word positive cautiously, aspects of the product, that consumers should be entitled to know that. The next speaker asked me for scientific evidence that of the advantages of vaping in South Africa. In my written submissions, I have given links to the international studies on it. I'm not sure if any of those studies now are South African. I don't think South African lungs are any different from international lungs. So I think that we can turn to the international space in terms of research for this. And I do think that there is strong research that vapor products are better for your lungs than tobacco products. Better, not best. Obviously, not smoking anything is best, and I do want to say that we do strongly stand by that is the best, and that should be communicated as the best outcome. I wanted to add something there. I think that there will be other presentations to you from organizations. I see that the next speaker this morning is an organization called Vaping Saved My Life, or something along those lines. And I think they will probably be better situated than I am to really talk about the scientific evidence. How are medicinal products controlled in South Africa when it comes to advertising was the next question. They are controlled in terms of the Medicines and Controlled Substances Act, which is scheduled substances, and substances over a certain schedule cannot advertise directly to consumers. They can only advertise to the pharmaceutical companies and to doctors, and in certain restricted ways. However, over-the-counter medicines are subject to the same rules as any advertising in South Africa, or unscheduled substances, which is that to make a claim, you have to be able to substantiate that claim. And we and another company called the Marketing Regulation Authority deal with these over-the-counter medicines, and we do from time to time receive complaints about them and pull their advertising from time to time. The next speaker labeled me as pro-vaping, and I do want to just be very clear, I'm not pro-vaping at all, and the Advertising Regulatory Board is not pro-vaping. We are anti-vaping. We are pro helping consumers know about what their options are. We are pro protecting consumers, and there is this large group of smokers who will experience a benefit if they can swap to vaping. And I think it goes actually, and I will leave this, but I'm speculating here. I also think that for the non-smoking consumer, the health benefits to us are there. I think that it is worse for our health to have someone smoking tobacco next to us. I walked through a cloud of smoke walking into the office this morning, and I wanted to punch everybody, compared to having people vape near us. I am speculating here, but I think there are health benefits there too. How do we control illicit trading in respect of vaping? This is not an advertising issue with every product, with tobacco, with vape products, with alcohol, with anything. Anything with food, with anything, there are safety issues, and that we respectfully leave in the Department of Health's hands. We would not want to trade there. We are not able to trade there. We are just about the advertising of the legal product, not the control of the illicit product. The next question I found a very challenging one. How do we stop vapor advertisers from encouraging people to start vaping? And that is the biggest challenge. How do we create a code that really carves out that we don't want to encourage people to start vaping? And I think that that's where the health warnings come in, which we have insisted on in our code, that there need to be health warnings, like in the limited tobacco advertising that there is in terms of packaging. There are health warnings. We need to have those health warnings. We need to be sure that the consumers coming to this field, to this product, are aware this is not a healthy product, and ideally you should not be starting. And I do think that our code could be expanded in that respect. That is something we could look at. And as I've said, I think that the legislation should be putting out the minimum requirements you would like us to have in the code, and perhaps the department will have some views on how the code should be amended to achieve that even better. Another very interesting one, how do we deal with the fact that ads obviously can't be targeted to smokers only? In an ideal world, that would obviously be the best, that we could make sure that only smokers saw the advertising for vapor products, and therefore only smokers could improve their behavior rather than non-smokers making their behavior worse. It is a challenge. There are some things in the code, like the placement of where the ads can be, like we do not allow it to be on the cover of a printed publication. It has to be somewhere where at least 75% or more of the intended audience are over 18. It cannot be placed in 100 meters of an educational, cultural, or sports location where people are likely to be under 18. There are things like that, but it is like with any advertising. The advertising of cannabis products, which respectfully is something we really, really need to be looking at. The advertising of sex toys. We deal with this question every day. We get this complaint. Really, when I tell you daily, we have a complaint about sex toys and or strippers and or prostitution and how those are advertised. It is an ongoing challenge that we have to try and draw that line, respecting freedom of speech, respecting that these are legal products, but still allowing where they are advertised and how they are advertised, and that they do not harm children. Sorry, the next question was, is there a difference between health benefits and harm reduction? Very much so, and that is why the code allows, and I'm just going to read from the code here, we allow claims saying safer than compared to tobacco, but we do not allow claims saying, no, sorry, it's the other way around. We do not allow claims saying safer than, but we do allow claims saying less harmful than. So you don't want it to be a safe claim, you want it to be a less harmful claim. So it should all be all around harm reduction and not health benefits. The health benefits is my wording in this presentation, that for a smoker, swapping from smoking traditional tobacco to vaping does have, it would seem, a health benefit. The next question asked me to share the self-regulatory code, which I think I have already done in this presentation, and it is available online. And then I was asked that, given that we find that there are a lot of new users coming to vaping who were not smokers before, do we think the code is working? The code is new. The code came in last year. So it's hard to say the effects of the code, and it also, I think, and I'm actually going to skip ahead now to the to some of the last questions, to do with the flavoring of the products and the mushrooming of vapor shops everywhere. Those two issues are issues that are not advertising issues. They are bigger issues. They are product issues. They are safety issues. They are where the shops are issues. They are licensing issues. I really do believe that those are issues that go more to why young people are coming to vape products so easily rather than advertising. And we see it again across the problematic areas of advertising. For example, as I'm sure you all know, the marketing of foods high in fat, salts, and sugar is a hot topic internationally at the moment. It's a hot topic in terms of Regulation 3337, and we see international research shows that advertising is a very small part of the big picture when it comes to why people are using these products. The issues of poverty, the issues of mental health, the issues of availability. I think that point about the flavoring, I could not agree more. I could not agree more that having a Fanta flavored product is a problem. But that's not an advertising issue. That goes to the product itself, and that is something that I will leave in your very capable hands. And I will hope to see regulation about. All that I'm here to talk about is the advertising of the products that you decide are acceptable and legal. So do we think the code is working? One other aspect I just want to talk about there is that we did research earlier this year on awareness of the Advertising Regulatory Board. And coming out of that research, we are now launching, in fact, this week, we started the soft launch, an awareness campaign about the Advertising Regulatory Board. My hope is that as awareness grows, we get more complaints in this important area. Consumer education around where they should complain to is a really important thing, and we can only act when we get a complaint. So we need to be getting more complaints here, so that hopefully our awareness campaign is going to be part of that. The Vapor Products Association does indeed sit on our board, as does the whole marketing industry, is represented on our board. Do I believe we are conflicted because of that? The first thing to understand, our members do not fund us. Our membership is about jurisdiction. Our funding model is we go directly to marketers and ask them to fund us. I do not believe we're conflicted. We rule against members. We rule against vapor products. We rule against members who sit on our board. So if ABSA, for example, has a member on our board at the moment, we will rule against ABSA without blinking. So I certainly don't think we are conflicted in making presentations on why we believe self-regulation is the right way to go for vapor products. You know, I'm a very ethical person. None of you know me, so whether that's true or not, you have no way to measure. I would not make a representation if I did not believe we were not conflicted in making it. But we do. One of the services we offer to the industry is we fight for self-regulation, because that is what we are. We are the self-regulator, and we do believe in freedom of speech. The use of personalities and celebrities was the next question. And I could not agree more. And I, in fact, am immediately after this going to go back to the Vapor Products Association, and I am going to propose that we put clauses similar. I'm actually quite shocked to find we don't have it there, similar to the alcohol code, which does not allow the use of celebrities, and has a few other rules about celebrities. I'm going to go to the Vapor Products Association and propose that we put it in the code. One of the great things about self-regulation, and I ask those of you involved in legislation not to be too jealous of me, is we can bring changes really quickly. We do not have to go through the bells and whistles and consultation processes that you do. So I'm hoping that I will be able to report back to you that I have brought that celebrity personality clause into the code. I agree with you. It's really not okay. And then the last two questions were about the flavoring to attract young people and the shops everywhere. And as I said, I do not believe those are advertising issues. I strongly agree with you on the flavor issue, and I also the shops. And while we at it, can we deal with those cannabis shops as well? Because I'm finding that very distressing as a mother of teens. And I have to tell you again, I'm going to come back to that point. As the mother of teens, I understand fully what you're trying to fight here. I fully support what you're trying to fight here. I'm just saying that there is a nuance to vapor products that the current draft of legislation is not recognizing, and that I think that it could recognize. And I think that working together in a co-regulatory system could achieve that.
Hey, you really have, yeah, no, you do deserve a bouquet of flowers. You have saved us a lot of time. But I'm very helpful. I'm very thankful with your comments that you have raised. I'll just make an example. If someone were to tell me, you know what, that thing that you are looking at, it has been brought into the market by Diana Ross. That's one of the famous and very powerful singer I love. So anything that goes with Diana Ross, I buy. So now I'm just saying, if we were to, I mean, maybe the youngsters don't know much about Diana Ross, but they know their own personalities, celebrities, and all that. So any association of any product with such celebrities will just go out in the market. I'm very grateful about your comments, and thank you very much. It will enrich our resolve as we discuss this matter further. We really thank you very much. We'll keep in touch with you. It is adding on to our collective processes of this bill. Thank you very much, Gail, and have a good afternoon. Good morning.
And I hope that I will soon be able to report back to you that I have added that to the code and we will not see Diana Ross vaping in any advertising coming up.
Just hold on there. Honorable Mutubase, there's a hand there. I see Honorable Mutubase.
No, I wanted to ask which album of Dana Ross would you like me to bring?
Oh, you were asking me.
Yes, Chair.
Autumn to bat. Autumn to bat.
I have all of them. Don't worry. Okay, Ms. Schimmel, we release you now. Thank you. That was an in-house question that Mutubas was asking. Okay. Thank you very
Thank you
much.
very much to everybody for your time and for allowing me the opportunity to answer your questions. And please, any further questions that come up during the day, you have my email. You please feel free to send them to me.
Will do, ma'am. Thank you very much. Okay. Yeah. Honorable members, we will then go to the next presentation. But let me take this opportunity to raise another matter, which we will not discuss because Dr. Letlap has apologized. There's a matter that Dr. Letlap has raised with regards to our work in this process. I've since had a discussion with the secretary, together with the manager of committees, of secretaries of committees, Mr. Pande, regarding how we deal with that matter. We would love to say next week we would have this discussion probably on Wednesday, because next week, Wednesday, we are having a virtual meeting with the Department of Health. They are presenting something to us. We'll have our normal Tuesday. We'll really ask your indulgence on a Tuesday, these presentations. But on a Wednesday, instead of starting at 9:30, honorable members, I will request that we start at 9 so that we have a discussion amongst ourselves regarding that presentation I will make, assisted by Ms. Machalamba, regarding what was raised by Dr. Letlape. Hopefully, we'll be in the meeting next week. And then we will take it and continue like that. Thanks. We would have discussed it today, but I just respected that he raised the matter and is not today in the platform. Apologize very well. And therefore, we'll discuss next week, Thursday at 9 o'clock instead of 9:30, 9 o'clock, and the department joins us at 10 o'clock. Thank you very much. Can we have the next presentation, Ms. Machalamba? Yes, Mr. Kurt, you'll correctly pronounce your surname well when we start. I am aware that you were part of the first presentation, but let me just welcome you again separately and thank you for coming in to share with us what you are going to share with us. And also say, we would also we noticed that you have got over 40 slides. Also, you will be limited to 30 minutes with your 40 slides. Thereafter, we will interact with you as committee members and then ask you to come back again to clarify us on the questions that you would have raised. So your 30 minutes starts now at 10:20. Thank you.
Good morning, Honourable Chairperson and members of the committee. Thank you for the opportunity to address you today. My name is Kurt Joe. I am the co-founder of VSML and serve as a consumer tobacco harm reduction advocate. My journey into this area started more than 20 years ago, 23 to be exact. It started with the death of my father, the day before our planned wedding. My father lost the battle against smoking with a sudden heart attack, leaving the entire wedding party to pick up the pieces. It was then that I decided to quit smoking. My promise to me and to my soon-to-be bride was to quit smoking. A promise I kept breaking over the next 10 years. Quitting is easy. I've done it many times. However, staying quit is a whole different ballgame. After 20 years, 40 cigarettes a day, and dozen failed attempts, I stumbled across vapes. More than 11 years ago, I smoked my last cigarette with the help of a strawberry dessert-flavored vape. During this time, I have lost my mother on our anniversary, my grandfather, several family members and friends, all because of smoking and the inability to quit. At 45, I was the fourth oldest family member on my father's side, with one remaining uncle and two older cousins. My story and those of the hundreds I've heard became the inspiration behind the movement Vaping Saved My Life. I declare that my contributions today are independent and grounded in science and consumer advocacy. I consult for the vaping industry, serve in an advisory role for the World Vapers Alliance, and I'm a scholar of the Tobacco Harm Reduction Scholarship Program through Knowledge Action Change, a project funded by the Global Action to End Smoking. I stand before you today not as an opponent of regulations, but a voice for smarter evidence-based approach to nicotine policy in South Africa. I represent the perspectives of consumers, especially smokers looking to quit, and to those who have chosen safer alternatives. They deserve access to safe alternatives, accurate information, and non-coercive public health policy. Globally, 1.3 billion people use tobacco, and 8 million die each year as a result. In real terms, more people smoke, snort, and chew tobacco than 2 decades ago, most of whom are in low middle income countries. I believe it's because most of the attention has been directed at supply and not addressing the demand. In South Africa, smoking prevalence has surged from 6.7 million smokers in 2012 to 11.1 million in 2021, a staggering 65.7% increase. This is not due to the lack of regulation, but rather a failure of enforcement and the lack of cessation support. It's estimated that over 40,000 South Africans die annually from smoking-related diseases. That is equivalent to a plane crash every day. Given the increase in smoking rates, we can expect more deaths and more morbidity in the coming decades. Many initiate smoking before the age of 18. The problem isn't the absence of law, it's the lack of enforcement. Any person below the age of 35 who initiated smoking before the age of 18 was not protected by existing regulations. Without visible deterrence, policies become paper targets. Regulations without implementation only feed the crisis. It must be mentioned that serious attention needs to be paid to monitoring the situation. Relying on unrelated surveys focusing on various topics is unhelpful. We need a standard set of robust, consistent reporting tools focused on nicotine consumption. These surveys need to measure the success or failure of legislation and policies. For example, lumping adolescents with young adults in a category that is unhelpful if we have adopted regulations that have prevented access to people below the age of 18. I have recently heard that 15 to 34-year-olds are classified as young people. This age grouping is nonsensical if the focus is on teens. The illicit trade is rising, with a 44.6% jump between 2019 and 2020, which has remained ever since. It has been suggested that the introduction of e-cigarettes and vapes has caused this rising smoking rates, with little data to support this notion. I would argue it has been an ever-growing availability of cheap illicit cigarettes in the country that has contributed to the current levels, which are now approaching pre-1993 statistics. A pack of illicit cigarettes sell for a fraction of the price of regulated products. These products undermine both health and tax policies. Poor regulation and high excise without enforcement fuel black markets, and the lack of compliance. Based on data collected during the 2021 Global Adult Tobacco Survey, we are seeing more illicit sticks being bought, and by extension consumed, making it more of a public health issue than merely a tax collection one. Not only are we seeing more people smoke, but we're seeing people smoke more. Our focus needs to strike a balance. Over-reliance on restrictions and poor enforcement has not yielded the results. We can expect a rise in smoking rate diseases and deaths in the coming decades if we continue to ignore the need for education and support in helping millions escape the harms of smoking. We need more options and clearer messaging to assist people who smoke to make better choices. The reality is that only 0.78% of South Africans quit in the 12 months before the 2021 Global Adult Tobacco Survey. Less than 2% of the previously daily smokers have quit long term. We are failing our citizens if the only message is quit or die. The World Health Organization's FCTC Article 14 mandates cessation support, but South Africa has yet to implement it. We need options, not ultimatums. The bill imposes steep penalties for smoking, even in private spaces. This raises constitutional and human rights questions. We must be cautious not to criminalize addiction or alienate those trying to quit. Coercion will not achieve the results that education and support can. We can all agree that the rights of people who don't smoke need to be protected. But what does it say about society when the rights of those who smoke are ignored, especially in an environment that does not offer support to help them quit? Cold turkey has a 3 to 5% success rate, the only option available to the majority. Other therapies like NRTs or prescription meds are expensive and often inaccessible. Harm reduction tools, vapes, pouches, nicotine pouches, and heated tobacco products offer a comparable and better outcome, yet remain financially out of the reach of most South Africans. We must improve access to these tools and change our attitude on smoking cessation. My favorite harm reduction moment in South Africa over recent years was the president introducing the new condoms. We understood the issue, listened to the population, relied on the science, and developed a product that not only tackled the known public health crisis, but introduced a more appealing solution. May I say fun? This is harm reduction. Harm reduction is rooted in pragmatism, dignity, and evidence. It is not new and has been successfully implemented in public health issues. It's about empathy. It's people-centered. It's about meeting people where they are. It is not an industry ploy. It's a public health strategy endorsed for decades. Professor Mark Russell, a South African scientist, was one of the earliest proponents. He reminded us, people smoke for the nicotine, but they die from the tar. It features and is acknowledged as part of tobacco control, found in the treaty that we ratified in the early 2000s. Even the most hardened opponents in tobacco expressed the need for a solution that could deliver nicotine with little harm. Matt Myers, the former head of the Campaign for Tobacco-Free Kids, had shared his wishes before e-cigarettes entered the US in 2007. The first tobacco company only got involved 5 years later. Harm reduction predates these products. It's a consumer-driven movement, not an industry invention. Reducing harm is aligned with core tobacco control, saving lives. Since the 1980s, we have known that the method of delivery is where the harm lies, with the introduction of NRTs. Since then, a range of products have been introduced that do not rely on combustion, making them significantly less harmful. New evidence shows that non-combustible nicotine products carry significant less risk. Lifetime cancer risk and toxic exposures are dramatically lower than with smoking. We must shift from the harm is harm ideology to the risk continuum approach. That's what saves lives. 8 independent reviews commissioned by Public Health England, now the Office for Health Improvement and Disparities, have continuously broadcast the same message. E-cigarettes or vapes are significantly less harmful than combustible tobacco. In conjunction with the Cochrane Systematic Review and the Khan Report, the UK introduces free e-cigarette kits in their smoking cessation services. The latest Cochrane Living Systematic Review, the gold standard in medical research, concluded with high certainty that nicotine e-cigarettes help more people quit than traditional NRTs. This is a live systematic review, which was first released in 2014. The secondary analysis of the Cochrane Review concluded that there were significant lower levels of biomarkers of harm in people who had switched to e-cigarettes than those who continued to smoke exclusively. Let us respect the scientific method. Randomized controlled trials and meta-analysis sit at the top of the evidence pyramid. Policy must follow science, not ideology or fear. The downplaying of the Cochrane Review is often cited in South Africa, relying on self-reported cross-sectional internet survey. What is never explained when presenting these findings is that the majority, the cost was the factor that resulted in the relapse. This does not disprove efficacy of e-cigarettes. ARVs taught us a valuable lesson. Life-saving treatments must be accessible and affordable to be effective. The same principle applies to smoking cessation tools. We have reached a tipping point. Major public health experts now call on medical communities to integrate vaping into cessation strategies. The evidence is clear. Switching completely to vaping significantly reduces harm. To ignore this would be a disservice to public health. Dare I say, public health malpractice. Leading researchers, medical practitioners like Dr. Colin Mendelsohn and Dr. Mark Tidal have long championed harm reduction. These aren't fringe views. They represent mainstream public health thinking rooted in evidence and compassion. Flavors matter. They help adults switch smoking to vaping. A large study found that no link between flavored e-cigarettes and youth vaping, but found an increase in adult cessation. We have forgotten that teens are curious and take risks. It's natural. Flavors support health when used responsibly. Remember the flavored condoms. Standardizing and color and branding of products introduce a double-edged sword. It might dissuade youth uptake, but it has the very same effect on adult smokers. Standardized packaging removes safety features that help consumers distinguish between legitimate and counterfeit products, a battle that has been fought for several years. The inclusion of vitamin E acetate in THC cartridges caused 68 deaths and 2,800 hospitalizations in 2019, known as EVALI. However, counterfeiting and using a branding of a well-known company had deceived many victims. EVALI crisis was adulterated THC products and not nicotine vapes. This is not promoting products. It's about stating facts. Suppressing data because it doesn't align with ideology is not science, it's censorship. Consumers deserve honest, evidence-based information. We cannot tolerate censorship of a message that is backed by the current available evidence. The gateway effect lacks support in population-level studies, which has been echoed in the US, UK, and New Zealand. Nicotine impacts the adolescent brain is still under investigation, even after so many years of tobacco research, with no conclusive human data. This fear originates from animal studies. Simply put, no ethics board would ever approve research that would experiment on the youth to derive a conclusion. The lack of knowledge is sufficient to justify restrictions to the sale and supply of nicotine products to minors. Our policies must reflect this nuance, not exaggerated risks derived from animal studies. The 2023 survey on youth vaping showed vaping is concentrated in affluent schools. One of the prerequisites for a school to participate in the survey was the students had to have access to the internet in their classroom. According to the National Department of Basic Education's annual report of 2022 and 2023, only 10% of all schools had access to such facilities. Reviewing the schools and the students that participated in the survey, we understand that these schools have an annual fee exceeding 20,000 Rand, up to over 250,000 Rand. That 69.1% of the students attended a single-sex school, and that 18% were attending private education facilities. This is hardly representative of high schools in South Africa. If you examine the statistics, you'll find that the denominators used to establish the percentage differ vastly, ultimately impacting the percentages in the findings that have appeared in the media. Responses to the most critical questions were skipped or missing. However, this does not downplay the need for the restrictions on the sale and supply of any nicotine product to the minor. It simply highlights disparities and the lack of robust research in this space, considering that only 269 15 to 17-year-olds were surveyed in the 2021 Global Adult Tobacco Survey, and the last Global Youth Tobacco Survey was conducted in 2011. Can we see research based on 25,000 high school teens in our poorest communities? And let us not forget about the estimated 40% that have dropped out of the schooling system. Real voices, real science, apologies. Real voices, real science. I urge the committee to visit our research library and engage with the consumer testimonials. These are people who have made the switch and shared their experiences. The mission hasn't changed. Reduce harms caused by tobacco smoking. Honourable members, we have the opportunity to lead, not follow, in tobacco harm reduction. Let us craft legislation that saves lives, respects rights, and reflects science. This bill fails to recognize the evidence-backed difference between tobacco products and safer alternatives, and intends to legislate them the same. Soft prohibition, stigma, and punitive measures have failed. Let's try empowerment and support the transition to better choices for a quarter of our adult population. It's not only for them, but it's for those closest to them. I thank you.
Okay, thank you very much, sir, for your presentation. You also did save us time, and for that...
I accept chocolates, Chair, not flowers.
That's fine, yeah. Honorable members, let me recognize the hands. Let me see. I've seen Honorable Van Staden now. He's number 1. Honorable Van Staden, you are number 1. Honorable Kumalo, you are number 2. Honorable Clark, you are number 3. Honorable Motubatsi, you are number 4. Honorable Sine, you are number 5. Let me see if I'm missing other hands here. Honorable Shabangu, you are number 6. any other hand?
Chair, I think you missed my hand.
I missed your hand. Sorry. Yeah, Honorable 7, Dr. Leroux.
Thank you, Chair.
Okay. Any other colleague I'm missing? Number 1 is Van Staden. Number 2, Kumalo. Number 3, Honorable Clark. Number 4, Honorable Mutubatsi. Number 5, Honorable Sine. Number 5, Honorable Shabango. And number 6, Honorable Dr. Leroux. In that order, honorable members, one after the other. I won't come in between yourselves. Thank you.
Thank you, Honorable Chairperson. Good morning, sir, and thank you for your presentation. It's much appreciated. Just a few short questions from my side. I just want to know if you believe that existing tobacco legislation is sufficient. My second question is, are you satisfied with the recent NETLAC process that took place? And if not, what is your reasons why you're not satisfied? My third question is, turn my paper here. My third question is, do you think that enforcement has been successful in general when 16% of the tobacco market is illicit? How many small traders and businesses in the vaping industry will be forced out of business when this bill comes to effect? And regarding legislation, would you advocate that vaping must be regulated under a separate legislation rather than the bill that is currently before us? And if so, what is your reasons why you would advocate for that? And then my last question to you is, you always see in newspapers, in the media, it's not advertisements, it's actually reports of people who's been getting very ill from vaping and all that stuff. And you've said before us this morning, and you advocate also for that vaping is much more healthier product than normal tobacco. Can you provide this committee with current scientific evidence regarding this matter? And just to come back to the third part of my question, where you see these articles in media that the vaping is dangerous and causing this kind of harm to some people who's using it, and youngsters with videos on YouTube and all this stuff. Can you just give us the correct information supporting by scientific evidence or consensus that the vaping product is much safer than the current tobacco product or the existing tobacco product? That's all from my side. Thank you, Chairperson.
Thank you very much, Chair. Let me also take this opportunity to welcome the presentation from the presenter. But I'm having some few questions in relation to the slide as presented. Chair, I will go to slide number 8. My question is, on slide 8, you mapped out daily smokers as those with the highest risk of diseases, while there are tobacco-related diseases that follow the dose response pattern. Are you aware that there are other tobacco-related diseases like asthma, cardiovascular diseases, sudden infant death syndrome that do not follow the dose response pattern, which means that regardless of the amount of frequency of cigarette you smoke a day in your lifetime, you can contract those diseases and die from them. How do you want to quantify such risk in your magnitude of risk and prioritizing population at risk? Also, your magnitude of risk graph, you need to explain the numbers indicated as youth initiation. Is this suggesting that the use of e-cigarettes among this group of smokers who initiated before the age of 18 could not be preventing their cessation and hence adding to harm at the population level? Chair, in slide number 9, on slide 9, you mentioned that the World Health Organization, FCTC, Article 14, talking about tobacco dependence treatment. Then my question, Chair, is what is the ingredient of the tobacco product that causes dependence? Is this ingredient also present in most vapes? Does tobacco dependence treatment described by the World Health Organization FCTC involve replacing one addictive substance with another addictive substance? There's nothing to be said about illicit except that it's not related to regulation but criminality by the tobacco industry. Therefore, I put to you that the suggestion that passing this bill will worsen illicit trade is the false narrative, not backed by evidence from other countries that have passed similar laws. In fact, Montenegro implemented graphic warning labels and at the same time saw decrease in illicit trade by 50% overall in a 2-year period. Then are you aware that greatest increase in excise tax with regard to regulation occurred during 1993 and 2008 when illicit was lowest, and the lowest excise tax increases happened during 2010 and now when illicit is increasing. Furthermore, that other experts have noted that the fact that the government allowed industry to manufacture cigarettes for export only during the temporary ban of sales in South Africa could explain the large presence of illicit cigarettes in South Africa. Would you then still say it was bad regulation or rather industry complicity in illicit trading that resulted in the recent dramatic increase in illicit cigarettes? Lastly, Chair, you mentioned that in your slide 13, you mentioned that you encourage individuals to take responsibility. Can you provide evidence that all messages that are normally used in promoting this product encourage consumers like our youth to take responsibility? Thank you very much, Chair.
No, thanks very much, Chair. Oh, it's 3. Okay, sorry.
On number 3. Thank you, Chair. Just a few questions, and thank you for the presentation, Kurt. Just the following. While the study citing reduced harm is noted, there are also studies that note that long-term use of electronic cigarettes or vaping products can significantly impair the function of the body's blood vessels, increasing the risk for cardiovascular disease. What I'm understanding from your presentation is that switching to vaping could eventually lead to not using nicotine products at all. Am I correct in that assumption? And if it is that, would you still vape? And then also note that more than 11% of learners that took part in the survey said that they cannot get through their school day without vaping. Given that vaping seems to be more socially acceptable than smoking in certain instances, and that many vapers do so in places where smoking absolutely would not be allowed, does that not increase the amount of nicotine consumed in a day due to vaping compared to smoking? And then just, if you had to change some of the clauses or remove some of the clauses in the existing bill, what would it be? And what is your experience with the law enforcement policing or illicit trade? And what is your opinion on electronic vaping products being regulated in the same way cigarettes would be regulated? Thank you very much.
Thank you
Now,
very much. Thank you very much. No, sorry, Chair. I was having challenges with my system. No, thanks very much, and thanks for the presentation. From your presentation with that invaluable experience, you mentioned some countries that have done well. Based on what we are doing, which country can you recommend us to visit to can help in embellishing what we are trying to do legislatively around here? Secondly, and this is a question that I almost ask everyone in respect of those people who promote vaping. There's a concern, and a legitimate concern, that some of the products that we have carry drugs. And not that they carry drugs legally, but they are used to hide drugs within, especially being distributed among the kids, and they are there in with some traders that are there. How would you recommend that that be protected, or have you considered how to protect our kids from purchasing those illegal drugs with regard to you participating in helping law enforcement agencies? Yeah, so that's those are the two questions that I wanted to present to you. But the other question that came to mind, most of the people who are in this space of the production of vape as carriers are necessarily not people, ordinary people, black people, Africans in particular. Isn't this an attack, or how many people are there in your space in South Africa who would actually benefit within the transformative agenda of South Africa as a country? Because you'd know we come from a recent history where blacks have been excluded economically, and they were trying to get into the tobacco industry, but then here we come again, they're excluded, they've been pushed outside of the mainstream economy. How many people currently would you say from that lower ranks of blacks participate in the vaping industry? And what would be your agenda to put them into the mainstream economy so that they don't become isolated, as it is the case now? And is your promotion of vaping not an attempt to isolate them further? Thanks very much.
Thank you,
Thank you,
Chair.
Chairperson. It's me.
I'm after Tubatsi. Unless
Oh,
if it
it's
is fine, you can
you are coming.
Honorable Sine now, who will be
Yeah.
followed by Honorable Shabangu, and the last one, Honorable Dr. Leroux.
Thank you,
Sine.
Chairperson. Thank you, and thanks to the presenter for also sharing his personal experience with regard to smoking. Chair, my first question, can the presenter please tell us the relationship between e-cigarettes and illicit cigarette trade? We are interested to know the difference. And we note between 65 and 75% of those who quit smoking, Chair, do so without assistance. And in South Africa, GATS, which is General Agreement on Trade and Services, results show that about 81% of those who quit or attempted to quit smoking did so without any assistance. So, are you aware that the statistics quoted here are unassisted smoking cessation is not correct, and that the most successful method used by most ex-smokers is unassisted? So, could it be that the presenter is misrepresenting the GATS data? If we can get that response, Chair. And my question two, on slide 5, it shows that smoking rates in the age of 16 to 24 went up by almost 100% between 2012 survey. And 2021 gets and others also increased but slightly. So does this not tell you that the unregulated availability of e-cigarettes during this period has not reduced the risk of cigarette smoking amongst youth? So does this not confirm others' concern that the availability of e-cigarettes could have normalized smoking in this age group? And my last question, Chair, is on slide 7, where you said 71.8% of the market is illicit. How come the so-called legal market is still declaring profits? Does this mean they too could be selling illicit cigarettes, which confirms what Mr. Franco van der Merwe said in the last previous hearing, that 80% of illicit cigarettes are produced inside the country? Yeah, those are my questions, Chair. Thank you.
Thank you, Chair, and thank you for the presentation that was done now. I've got a few questions on this presentation. In your slide 13, you mentioned that you encourage individuals to take responsibility. Can you provide us with evidence that all your messages that are normally used in promoting this product encourage consumers like youth to take responsibility? Because I think you will understand that we are pushing this and we are more on preventing and protecting our youth in South Africa, especially those that are not smokers, to prevent them from smoking. Can you provide us with that information? Also, in your slide 14, if people smoke for nicotine, I understand that it is primary an addictive component of tobacco and other nicotine products. Don't you think it is an oversimplification, considering that other sources of nicotine, like medically approved, which is NRT, don't cause addiction? Don't you think this is an oversimplification if you consider that fact? Also, in your presentation, you ignored other factors that contribute to smoking behavior. For example, psychological, social, and environmental factors, of which other researchers, they've picked this up, that they also contribute to smoking behavior. But in your presentation, you ignored this fact. Can you provide us your reasons for ignoring these other factors and only choose to focus on nicotine? Would you agree that vape products could sustain nicotine addiction rather than helping the users to quit completely? Then that echo, I don't know whether it's from my side, Chair. Then you also quoted in your slide 15 the article by Hugh, the Framework Convention on Tobacco Control, which supports harm the reduction initiative. But you also choose not to highlight other parts of the sentence, that is harm reduction that aims to improve the health of population, not few individual, because that is what we are here about here, to improve the health of the population, not of the individual. But that you omitted, or when you were doing your presentation. Is this argument not manipulating the true intent of this paragraph, understanding that tobacco harm reduction as we know it now did not exist back then in 1999 to 2003 when this treaty was negotiated. In the same slide, you also did not highlight that there is a time lag between the exposure to smoking and the other uses of tobacco product and the onset of tobacco-related diseases. Do you think that to manipulate such an information is fair? Already the short-term effects of the use of using these products are known. So why should South Africa not look into the future health risk? And my next question will be on your slide 16. I hear that the certificate said someone could devise a product that gives satisfaction as tobacco, but killed none of them, and people will flock to it. Can you confirm that the current newer products you are providing are not posing health risk and even risk of death to anyone? You are, in your presentation, you are advocating for flavors. And like I've indicated that others, sorry, I didn't, I recognize that you only use 2 studies to support your argument. Are you aware that other studies that found flavors were associated with youth uptake? And would you agree that the flavors are designed or at least promoted to attract new users, especially the youth? Why should we use flavors, colors? Who are we attracting? And it has been mentioned several times that those colors and flavors, they're not attracting a 60-year-old, a 70-year-old, but it's targeting the youth. That's the fact. How can you justify that? Are you aware of any countries that have smoking restrictions for those aged 21 years and younger? And my last question, Chair, is in the presentation, the WHO FCTC in this consideration was quoted as it mentions children and youth. Do you know what age group is defined as youth in South Africa based on the Youth Commission definition? If so, do you agree that we also have the obligation to protect our youth, as I've mentioned, and that focus of 15 to 17 years you mentioned? Thank you, Chairperson.
Last one, last one.
Thank you very much, and thank you for the presentation. And yeah, I mean, it was a dense presentation with lots of information, and it's a bit of a pity that Dr. Lehlape is not here because he is also a big proponent of the harm reduction approach. But thank you for the food for thought that you brought us, and also for sharing your personal experience of benefits for you of using vapes and rather than smoking. And I think it's certainly worth considering how that vaping is a less harmful alternative to smoking, and how we can encourage that. But also, I think the big concern from us as a committee, particularly, is trying not to get people to start vaping afresh. And I think there's three aspects. The one is there there seems to be significant benefit is when people are smoking and they either use vaping to stop completely or they use vaping instead of smoking, which appears to be less harmful. The second is that we have adults who might start vaping fresh, which is worse than not vaping at all. And then thirdly, it's the teenage who start. I think so. I guess my first question to you, in terms of the flavoring, you made a strong argument that flavors are helpful and it's a way to get people away from smoking into vaping. I mean, our major concern is it's a way of making vaping attractive to people who are not on vapes, and so. We need to balance those things, and I don't know if you've had any thought about how one balances those things. I think, and could give any input on that aspect of it. The second thing was I don't think you really spoke about it, but I think your argument throughout is making vaping easily accessible so that people who are smoking can switch out. And again, if we do that, it does also make it easily available for those who are not vaping at the moment, or for the young. Your perspectives on single-use vapes. I think there have been arguments made that single-use vapes, number one, are bad for the environment, but secondly, also that it makes vaping much easier to get into. And so the single-use vaping provides much lower threshold for teenagers, for example, to join. But if one was to insist on the more expensive vaping devices that are longer lasting, that would also make a barrier to people who are trying to come from smoking down to vaping. So, your perspectives on that would be interesting, and again, how to balance the smoking population who could benefit from this versus the non-smoking or the non-vaping population who are not at all using these and might be attracted into them. And finally, I think I just wanted to. I mean, a lot of these slides are very dense and helpful, but we'll need further looking through them. But I just wanted to get a sense from you did go through it very quickly around the using vapes as a method to. I think it was on slide. This is slide 11, and the smoking cessation methods. If you could just maybe go through that a little bit more in detail in terms of what the more helpful methods are, and where e-cigarettes or vaping fit into that. Thank you.
Asking the questions last makes you to just add on or amplify what my colleagues have just said. The starting point would be to say the going up of the smoking in the country, which you have come up with in your slides. One would also argue that there may as well have been also an increase in the e-cigarettes. What's your take? I did not see those figures coming in from that part of the e-cigarettes, only the smoking part that you presented. And then one of the other interesting part I would like to raise with you is that we just need to be assisted by your understanding, because you are strong on this part, what evidence you have that harm reduction has assisted us in the country. Strongly so, maybe pointers or references that you can use. But the other part, your starting personal story was very attractive to me. The only part that was making me, which may be in terms of being a future presenter on some of this place, maybe do withhold the information that you then got to be attracted to a strawberry vapes, because to me, you already are promoting a flavor. Because people will say, look, I would smoke and have this mint or menthol flavor, but why do you bring the attractive ones? It's because you are having a targeted group that you are now looking into. And it comes down to what my colleague has just said, Shabangu and Dr. Leroux, that once you put flavors, it's as good as you putting certain personalities. In fact, I might as well add by saying it was a very unfortunate sort of, in my view, it was very unfortunate that you included a slide of the deputy president then advertising the use of condoms, because in that space, we're not attracting grandmothers. We're targeting the young people who are saying, look, this and that, can you make the condom flavoring? Where is the highest HIV pandemic in the country? It's from the 16 to 24-year-olds. if you are targeting those people and they are saying, make the condom smell nice, give us vanilla flavor, grape, and all that, you do that. I can tell you now, because I was part of those debates, there were some of us who were not agreeing within that, but okay, it's not an issue of saying, did Lomo agree to this or not? Overall, we said, let's err on the side of doing what the young people are saying. But we were not saying, look, if it has to deal with the increase of an uptake of condoms, and they're asking them to be flavored, let's do so. But please don't use that as an example, because you are also saying to us, you are attracting this 16 to 24-year-old age group for your products to be attractive to them. Why don't you stick on menthol and mint, which is actually what we probably find in tobacco? Because that you are also attracting is as good as we are using certain personalities that are famous to that. Once you put a flavor to say, you come into my vapes, you will find a grape flavor. That is not. In fact, you'll probably be able to, you in that space, will not really make us very comfortable with it. But I'm saying some of the people who lost the argument on the condoms to be grapes or not are still there. And we then said, okay, let's err on the side of this if it's going to attract people. We want young people to use a lot of condoms, all of them, so this time around, if you are also targeting the young people, which is what is going to be there, then you probably won't find a lot of comfort with those who would want to. So if you are going to say you only want to market your product, provided this is flavored with all these things, then you'd really be fighting against a very strong wind, which I would really think that probably is not where you want to go to. I wanted to also say the vapes. Now, let's give you a benefit of doubt that you are actually correct and maybe your theory will work. That if you introduce at your age vapes, you will probably move away a lot of citizens who are currently on smoking because of the benefits. That is, you don't have secondary smokers. There will not be this and that. You'll reduce significantly some of these issues. But then, why would you therefore say, why are you therefore also attracting people? So for some of us, we would like to see less and less vape and less tobacco in the long run. So why should you still be attractive to the 19-year-old and the 20-year-old with your vapes to such an extent that what actually Honorable Dr. Leroux is saying could matter, to say maybe let's probably be agreeable to vapes that are of my age, people can afford, but all these single vapes that are cheaper, easy to access, and therefore that are targeting the young people, with some of those that we may not really have to agree on. In fact, they also, I was wondering, somebody was teaching me about them having a huge impact on the environment by helium batteries and this and that getting to water. So say maybe one could be flexible and understand you want your product vapes, but maybe not the singles, because those are targeting a particular age group that we do not want to find. And maybe a theory of harm reduction and switching over from tobacco to vapes does work, but why then should you bring along people who have never started? Why then should you bring along a 16-year-old? Because they are not switching on, they are starting. So in your assistance to the country, target those who want to switch over and leave those who have not started and not attract them. Okay, Dr. Letap has finished in his engagement of the day, and I will only allow him because he has joined now. He had indicated his unavailability because he had another business to conduct. Dr. Letlape, you are recognized. Did you hear the presentation or I assume that you read it? Maybe then you want to come in and ask questions.
Thank you, Chair. I've read the presentation, but I was still in court when the presentation was made. My apologies for coming on late. I just wanted to make a few comments before the presenters make a comment, just to say to the members that the issue of flavoring nicotine is a very, very bitter substance. without any flavoring, nobody will ever take it. So the issue of flavors is to make it palatable to people who smoke so that they can see it as an alternative. If it has no flavors, trust me, it is not takeable. So people should not look at the issue of flavors as an intentional attraction to youth, is to make the product palatable. But it does not mean it should be open season. That's why regulations are important in terms of what flavors you're going to allow. There is flavors that are named such that they can only be attractive to young people. So there needs to be a discussion around regulations around flavors. So it can't just be an open season, Chair. And I think one of the key issues that will come up is the fact that even though the alternatives to combustion like vapes will be useful to people who smoke, we need to come up with mechanisms of how we ensure that those that are nicotine naive do not take up the vapes. And youth uptake is a problem, like in many other things. We have the same problem with alcohol that has many, many flavors. They are peach now, they are fruity, they are whatever. They are attracting young people across gender. Those issues need to be looked into in terms of what is allowed and, more importantly, the marketing of these things. So I think one of the key issues, Chair, is going to be how do we ensure that whatever is an alternative to combustible cigarettes goes to the targeted population and not to nicotine naive people. But it's going to require that we recognize that they have a role to play in the lives of those who cannot quit. And it needs to be added, like it's done in other jurisdictions, to the armamentarium of the alternatives that are available to people that are addicted to nicotine. The notion of new entrants is something that we should be mindful of, and we should work together to ensure that those that are not using nicotine, whether they are young or they are adults, should be encouraged to stay away from nicotine. So I thought, Chair, I just want to make those comments that what we need to be able to do is to differentiate, but we need to be mindful of youth uptake, just like it is a problem on many, many other issues. Even just sexual debut, we have 10-year-olds that are getting pregnant, and we're not going to ban sex, but we need to educate people about when it would be appropriate to go into sexual debut, what the implications are. That's all the comments that wanted to make at this point, Chair. And thank you, Chair, for indulging me.
Okay, thank you very much, Dr. Letap. Just to assist the honorable members, he brings us to the scientific world, Dr. Letap. He talks of nicotine naive individuals. So don't feel offended, honorable members, that is actually insulting people. It's a scientific term that you have never in your blood, in your body, ever had nicotine. So we call you nicotine naive. It's like when you're starting to give people medication for ARVs, the people have said they are ARV naive. People have never had them before, and then you start them. There's a difference between being nicotine naive, ARV naive, than having tasted it before. So just to help with that type of a terminology that is coming in, it was very interesting that Dr. Letlape assumes that we all know what is to be nicotine naive. Okay, let me bring it back to the presenter to assist us with the clarity on these questions raised. Thank you.
Well, thank you very much, members. A lot of questions. I hope I cover them all. If I missed some, please feel free to jump in and issue some kind of or advise me that I've missed them. In terms of, do I think that the existing tobacco regulations is sufficient with regards to tobacco? I would say, or cigarettes, combustible tobaccos, I would say broadly yes. The issue that we have is not that there's a lack of regulations. The issue is that there is a lack of enforcement of these regulations. And that's not just particularly pertaining to the 1993 or the 3 amendments thereafter. It also refers to things like the illicit cigarette trade and so forth. So I feel generally that there's a lack of regulations. As I stated very early on in my presentation, I am not opposed to the regulation of vaping products. My only concern is the bill that's before us lumps 2 very, very separate products as one. There's very little distinguishing the difference between these products, and I find that is, problematic because they do fetch different harms, they do fetch different risks. Do I believe enforcement successful? I think the statistics tell the story itself. We've seen growing number of smokers. We've seen a growing number in the illicit trade. So I think the statistics speaks for itself. In terms of separate regulations, I don't know if we have the time or the luxury of space to have separate regulations. I think we need to craft maybe the existing bill before us to ensure that there is a clear distinction between these 2 products. We desperately need regulations with regards to vaping products. And we also need to consider that there are a host of new nicotine products that are coming into the market. I don't believe the current bill before us covers nicotine pouches, for argument's sake. In terms of the health risks in the media, there's no way that I'll ever say that vapes are harmless. It would be frankly silly for me to say vapes are harmless. But when compared to combustible tobacco, there is significant difference with regards to risks. And that's purely because when you remove combustion from the equation, you immediately see a reduction in risks. That is the reason why we have things like nicotine replacement therapy. In terms of, I acknowledge that, yes, there are some cases where people that would smoke. Sorry, there's a strange noise coming through here. In terms of, the diseases in younger people because they are smoking and so forth, there's no doubt, yes, smoking will exacerbate or maybe even cause bigger problems if a person has asthma and a whole host of another disease. From a broad perspective, what we suggest or what we've seen, not just now, but for over a long period of time, is that people die prematurely. And typically, it's the people between the ages of 50 to 60 that we see the biggest deaths and cancers and smoking-related diseases is generally found over long-term period. The doctors in this particular forum might be able to correct me on this, but it's widely understood if you are a smoker, a long-term smoker, and you happen to quit by the age of 40, your chances of developing certain cancers and respiratory diseases and cardiovascular diseases based on your smoking habit is significantly reduced. So that's why there's always this message that goes around saying that it's never too late to quit smoking, but it's always better to quit earlier on in your life. So yes, there's the acknowledgement that there is definitely diseases in the younger population or younger populations, and those are typically not the general findings. Sure, there's a lot of things here. Yes, ingredients in vapes and other products that, nicotine vapes has nicotine the same way as nicotine replacement therapy has nicotine. Nicotine pouches have nicotine. So there are these ingredients, and these ingredients are addictive. And again, I will always, as a consumer advocate, not advocate nicotine naive individuals to pick up any vape or even any smoking. They do contain nicotine. In terms of, I think broadly speaking, let's talk about the flavors. And I'm just going to share another personal story. I know that I had shared my story with using strawberry vapes. And that's a fact. Strawberry vapes helped me quit smoking. My cousin is in her 60s, and she's a long-term smoker. She smoked since her teens, very long-term smoker. And I had tried many times to help her quit smoking with the help of vapes. And this also answers the question around disposables. I have a love-hate relationship with disposables, and this is the reason why I do have this particular story, is that in her 60s, wanting to still quit smoking and not being able to successfully quit using any variants of vapes, she had used a disposable, a grape-flavored disposable at the age of 60. And that was 2 years ago. She no longer smokes, and she no longer uses disposable. She uses now a disposable pod system, and it's still flavored. The other remarkable thing is that her nicotine consumption or nicotine strength has also dropped. The reason why I have a double-edged or a love-hate relationship with disposables, because there is no doubt about it, these are disastrous when it comes to the environment, absolutely disastrous. But for many people out there, that's the product that they, particularly the older generation, that is the product that they find most acceptable, is because it doesn't allow, it just becomes more convenient for them to use, like a cigarette would be. It replicates a cigarette in terms of the way it feels, and yes, they come with flavors. I just want the members of the committee that think about flavors is that, have you ever seen a nicotine replacement therapy in a tobacco flavor? Because we've been using nicotine replacement therapies since the 80s, and they come in different flavors. In South Africa, we used to have a fruit flavor, we no longer, but we have a mint and we have a menthol flavor. But nicotine replacement therapies have flavors like fruits and so forth. It's because exactly what Dr. Letlapa has said, nicotine inherently has a very bitter taste. It's a peppery taste. So it's used to mask that particular flavor. But it's also used, like we've seen in a whole host of public issues or public health issues, for example, dietary and so forth, is that the flavors help people make those better choices. And I agree with what Dr. Letlapa was saying with regards to the way we market and the way we name these flavors is more problematic than actually having flavors. What I would like to suggest and like to look at is when we see a regulation of flavors, we make sure that there are certain chemicals that are not in those flavors that will make them harmful. And the way that we promote and market these flavors are not based on kiddie names or looking at kiddie marketing strategies, that there are very clear description that this is a strawberry flavor, this is a... So I agree, when we talk about Fanta and all these other things, it's inappropriate, but we can't move away from the fact that flavors do help people make better choices. We see it in health, in dietary, we see it in nicotine replacement therapies, we see it in certain medications. In terms of the long-term risks and the short-term, known short-term issues, the evidence that we currently have before us, for example, using biomarkers and so forth, indicates that in the short to medium-term risk, these products are significantly less harmful when we look at, for example, the biomarkers. There's no doubt that we should not stop researching these products, and we should, and unfortunately, we don't have the benefit of time or at least a crystal ball to see what these products will do in the future. But at the moment, what I believe is that we have such a huge issue around smoking, particularly in this country, And my whole presentation was not about just promoting vapes. It's about helping people quit smoking and introducing as many tools as we possibly can to help them quit smoking. You know, one of the biggest issues that I find is that people say that vapes, just because they are vapes, they're attracting the youth. But my attraction to smoking wasn't because of anything other than I was surrounded by smokers. And my entire family, or pretty much most of the people in my family, were all smokers. And many of them have passed away because of smoking. So there's a lot of nuance around this. We just can't be too binary around, is there smoking, vaping is attracting the youth. There's a whole host of other issues we need to raise. And I agree with it. One of the members there spoke about, the psychology, mental health. All of these things need to come into it. It's a very, very complex environment. And we need to really look at all those points. In terms of research, let's look at drugs and vapes. Once again, a big concern, a massive concern. We saw that in 2019, where they were using THC vapes. I mean, THC vapes have been around for a while, but they introduced vitamin E acetate in these vapes that make them deadly. Again, I mean, that's about testing and standards and making sure that these products meet a certain standard, meet certain safety. And it's the same scenario that we'll find drugs in a whole host of other things. It's a drug-related issue. It's criminality, and it needs to be addressed. We can't simply say because. Can you imagine we stop all intravenous needles, which we use, for example, in treating type 2 diabetes, purely because people use them to administer street drugs? Those are the issues that we need to tackle with. In terms of most people have quit without assistance. Absolutely, in an environment where that is the only option, that obviously will be the greatest percentage. If you have a society that, let's say, for example, 10% of the population who were former smokers had quit, and the only method that they used to quit was without assistance because there was nothing else to assist them with. The question is, can that 10% be extended to 30% if we introduce tools and support to do so? And if we go back to, for example, the FDA or even the World Health Organization, they have indicated that when people try to quit without assistance, it's an incredibly unsuccessful route. Anywhere up to 5% of those individuals are successful without assistance. The research is out there. You can find it in the US FDA's pages, and you can find them in the World Health Organization's pages, that unassisted attempts are really, really unsuccessful. But in an environment where there is no other solution, obviously you will find more people quitting without assistance when there's no other solution available for them. Hence, the basis of my argument is that we need more tools, more accessible tools, more affordable tools to help more people quit. We cannot just rely on cold turkey approach. In terms of the tobacco industry showing profit whilst the illicit trade is growing, I think I heard the presentation where they said that majority of illicit cigarettes are produced in South Africa, and yet companies are showing a profit. Again, profit isn't an indicator of growth. Profit is an indicator of other issues or other practices within a business. And the other thing is that some of these businesses, for example, British American Tobacco and Philip Morris, are showing greater movement into safe alternatives, and they're seeing their the contribution to their finances due to cigarettes is shrinking. It also is mechanization. It's also a reduction in overheads. It's all of these things that determine a profit. So yes, they might be showing a profit, but how is that profit generated or gained? Is it through illicit products? I don't know if it would, and if we would be able to reflect that but again, that needs to be addressed with the tobacco industry. As a consumer advocate, I mean, I can't really comment on that, although I have a little. In terms of the slide 16, I think it's slide 16 that keeps coming up with the principles of harm reduction. Again, those are principles. And what they are built on is those 7 points in terms of, is there any evidence to suggest these things? Not that I'm aware of, apart from that harm reduction has been used in a whole host of public health issues. If we think about the introduction of safe needles and safe injection sites, the introduction of methadone purely in the drug space. And I think that's why I had suggested, highly recommended those 2 books, because both those gentlemen have a wealth of experience and knowledge in harm reduction in other spaces, in particularly drugs, particularly Dr. Tyndall. So I recommend those books because they do have all the evidence and the science that they rely on to suggest that vaping is a really, really viable option to help people quit smoking. In terms of nicotine and the continuation of addiction, again, as what Matt Myers had said from the Campaign for Tobacco-Free Kids, the real issue that we're facing from a smoking perspective or the tobacco perspective is that people smoke for the nicotine, but they die from the tar. The risk is the method of delivery of nicotine. It's the nicotine addiction is secondary to what happens or the way you consuming that nicotine. The real public health issue here is the smoke and people dying from smoking related diseases. They're not dying from nicotine. They're dying from the way that they are consuming nicotine. I mean, would there be an issue instead of me using a vape product to stay off cigarettes that I continually use nicotine gum with the same nicotine strength that I'm currently using the vape? Would there be an issue if I just continuously use nicotine gum rather than a nicotine vape? I believe not, because I'm moving away from the harms of smoke. In terms of FCTC is supporting harm reduction, I think a very good person that maybe the committee should consider talking to is Dr. Derek Yak, which was part of those negotiations, and he will tell you and maybe bring you closer to why that harm reduction strategy was included in Article 1D. I don't want to share that. All I wanted to bring to attention is that harm reduction strategies felt part of the broader tobacco control approach. It's not just about restrictions. It's about introducing demand reduction, and part of that demand reduction could be introducing harm reduction strategies. But I really recommend that the committee has a chat with Dr. Derek Yak, who was one of the authors of the FCTC's framework. I'm trying to see if I've covered all the points here. I think, broadly speaking, honourable members, is that I certainly don't want, I am a father of a 15-year-old. I certainly don't want to see any nicotine naive individual pick up vapes, especially people that are under the age of 18. I definitely don't. My concern with this particular regulation and our approach to this topic is that we tend to think or believe that if we just keep restricting, we'll eventually get to a point where it would stop. I haven't seen any evidence in the world where that has been the case. Where we do see fast or accelerated declines in smoking, it's typically a combination of all the things, not just one thing. In terms of where I would recommend going to visit to see how harm reduction has assisted, I think Sweden is a very, very good location. I think New Zealand is also proving to be very successful. The UK has also proven to be successful, and I do acknowledge that the UK has now banned disposable vapes purely based on the environmental impact on that. So I would recommend definitely those 3 countries. But I would also think and recommend that whatever research we do in this country is that we now look at speaking to people like myself who had managed to quit and are currently using vape products. I find it concerning that we don't have that kind of research in South Africa where we approach vapers, people that have used these products to quit, and get their understanding. And in my eyes, it's not good enough that we just say, these are smokers, these are vapers, and off we go. In my eyes, we should be considering why people continue vaping, why people had switched to vaping, what were their history, why we need to, a far more in-depth, robust discussion around this particular topic. I think I've covered all the points. If I have missed, please, by all means, let me know. Thank you.
Yeah. Okay, I think you are also pleased that we have had this platform with you, because we have had various platforms where we did not ask you questions, but you have made various presentations in the various public hearings that we have had in the country, which also what today you are doing was like now in a sit-down situation, us taking notes properly, engaging with you. But it's not like we are not we are seeing you for the first time. Thanks for the adding on to what we already shared with us. And thanks for the information you are giving us about Sweden. I hope you also take in the spirit that it's not like you are keep on restricting. We are probably wanting to move towards the world countries that have done well, Sweden being one of them, in terms of that. Because the bill is not completely banning everything. It's really restricting, you are correct. But we have been enriched by your presentation. Thank you very much, as we have done in the public hearings that we have met you there making presentations. But this one now well documented, your views and the views of vapes. Thanks for sharing with us that Sweden, among other things, have decided to ban these disposable vapes, but have left the other vapes to operate and regulate them in a way that is also assisting us as we navigate this process. We wish you well and say we may interact with you. We have found you to be sharing with us information that we are not aware of, but that we need to work on as a committee going forward. Thanks very much for your presentation and we wish you well. Bye-bye.
Bye-bye. Thank you.
Okay. Okay. Honorable members, this brings us to the end of our meeting today. As we plan to move into other sessions in Parliament, I don't know where we're parking in the city, in that place, in ICC. I've indicated to Dr. Chapter that there's an item we are going to bring related to what you raised last time. We will deal with that item at 9 o'clock on Wednesday next week, just an hour before we get a presentation from the Department of Health. But before that, honorable members, we will get a notice of a meeting on Tuesday. The whole of next week, Tuesday, is committee. So I know honorable members will also have other engagements in other committees, but we will have another meeting at 9:30 on Tuesday next week. Thank you very much. Have a good afternoon. Yes, Honorable Mutubatsi?
Can I be excused on the 17th? Is my birthday, Chair.
We'll send you flowers and chocolates.
Oh, better the spotlight in Tubatsi.
Thank you very much, honorable members. Have a good afternoon.
Love you, the chair.
Bye.
Bye-bye.
Thank you, Chair.